You know, I don't like to do takedowns of people or specific individuals with their plastic surgery, but I love to talk about situations like this because this person put her whole story out there for all of us to see and experience. So I'm going to jump on it, and really I'm going to use her as a great example of what can happen and what can be done. So clearly this woman has had breast implants in, and it looks to me like they've probably been in there for a while. I don't know if she had them in, let's say, before some significant weight loss. She is obviously very, very fit, has a very low body fat percentage, and in the picture you see here, her implants to me look like they have dropped down. She has lost every bit of volume in the upper aspect of her breast, and it's just very robust pec muscle down to the implant, and then just a big whoop where the implant is. This can happen both with time and in a person who's very thin, and there are things that can be done to fix the implants. I looked at her pictures afterwards, and I think that she had a revision obviously done. To me, it looks like her implants were likely downsized. She may have an implant that's a little more cohesive or a little more firm that allows maintenance of that upper aspect of the implant to be a little more robust and there for her. She probably, again, had a lift that holds things up. I am willing to bet that someone who did her surgery put a mesh in there to hold things in place. And I think a really interesting question is, what was done to create a more natural slope? I see a lot of her videos, it looks like there may be some post-operative swelling that has subsided. But if I was taking care of her, I would have had a conversation about transferring something up here to soften it. Now, she probably doesn't have a lot of her own fat to transfer, so that's where I would use something like alloclay, which is cadaveric fat, to go in there, soften up that upper pole. Most importantly here, though, is that this is a person who clearly is invested in her body, in her image, in herself, and I think in her health. And what I really love is that she is sharing every aspect of her journey, including the tough stuff, to the world. And listen, I've seen this time and time again. The world can be mean, and she's had to deal with some really not nice comments, but she persists. I want to congratulate her for getting this message out, and I think she's done a beautiful job. So is her surgeon.